If you happen to suffer from leg pain, swelling, maybe visible varicose veins, it may actually be the sign of an underlying condition, and it may be something where you actually need to see a doctor. I'm here with Dr. Michael Levy. He is a surgeon here at Ohio Vein and Vascular. It's so nice to see you, Dr. Levy.
Nice to see you too.
So for people who aren't familiar, what exactly is it that you do here?
In our practice, we like to say, on everything leg, but we do some things besides legs too. Most of our practice is dedicated to venous disease in legs and arterial disease in legs, and we do work on some arteries outside the legs. But our primary interest is in vein disease. So, as you mentioned, things in vein disease: swelling, burning, itching, some cramping, wounds on the feet, discoloration. And arterial disease can have similar symptoms. So those are the things we focus on.
So you've mentioned quite a few symptoms. For the people that are watching at home, how do you know if it's just, you've been on your feet, it's been a long day, versus an underlying medical condition where they do need to see you?
Well, it depends on the severity of symptoms. Obviously, if you have a big, huge exercise day and your legs are a little tired, that's fairly normal. But people who have swelling consistently, people who notice a big difference if they elevate their legs, that's actually not really normal. It's about a third of the population that notices that. And that can be a symptom of significant venous insufficiency or significant problems with your veins, where the blood's not getting out of your legs adequately. Obviously, if you have wounds or areas of discoloration, those are more significant symptoms.
Okay, so they come in, do they get a consultation first, or walk me through the process?
Okay, we obviously see patients who are referred by other doctors as initial patients, if you will, but we also provide free screenings where the nurses who work with us and one of the doctors, we examine the patients, we do an ultrasound, and we try and figure out what's going on.
And then you say, okay, you're the perfect candidate for surgery. How do those procedures go about? Is it something that is really time consuming? Is it a very serious procedure?
Okay, well, we kind of divide patients into vein problems and artery problems. Artery problems can be life and limb threatening. They can also be associated with heart disease and stroke or cerebrovascular disease. So that's one set of problems. The other thing we see is venous problems, where people have venous insufficiency or varicose veins. So those we evaluate, we decide what needs to be done. Generally speaking, the stuff we are treating is all covered by insurance. They're easy procedures. These are not the more morbid procedures that people used to have 25 years ago. Vein stripping, we don't do those kinds of things. It's not necessary. We have much more advanced and referred to as minimally invasive techniques.
Okay. And, when you think about vein issues, sometimes people tend to think about the cosmetic issues, but these are issues that are more serious. But by coming to see one of the surgeons like you here at Ohio Vein and Vascular, you're able to take care of the problem so that people are able to live healthy, active, normal lives afterwards.
Correct. These procedures reduce symptoms.
Yeah.
Okay. In general, they're not life-saving procedures, but they're things that make you feel better.
Yeah.
Cosmetic issues that are purely cosmetic are not our focus, but frequently taking care of the underlying more serious venous disease makes the cosmetic issues much less of an issue.
And then I guess my only other question is this something that is found, in families? You're genetically predisposed to develop these issues, or is there a certain age where people start to see these problems kind of popping up, or does it really vary by person?
That's a great question. If your mother had some sort of vein problem, even if it was teeny spider veins, you have about a 40% chance of having a vein problem. If your father had that issue, it's about a 50%.
Really? Why the difference?
Unclear.
That's so interesting.
If both parents had vein problems, it's nearly 100%.
Okay.
But having said that, there are 5 classic risk factors: smoking, obesity, pregnancy, sitting or standing as opposed to walking, and genetics. But we certainly see patients who have all 5 of those risk factors and don't have problems with their veins, and people who have none of them and still have vein problems. About a third of the population really has problems with their veins, and about half of them would benefit from having some sort of intervention.
Well, this has been really enlightening. I appreciate you taking the time to talk with us. Again, Ohio Vein and Vascular, we are here at the North Canton location, but there are many different locations all throughout Northeast Ohio, so you can find the one that is nearest to you.